Hey guys, I'm Dr. Cam, CEO of Maximus and medical school professor, and I'm here today to talk to you about our revolutionary new Maximus Oral TRT Plus protocol. What is Maximus Oral TRT Plus? Maximus's new Oral TRT Plus protocol is a combination of two prescription medications. The first is oral native testosterone, and native testosterone means it's the natural testosterone that's bioidentical with the testosterone that your body produces. Now, a lot of places throw around this term bioidentical testosterone, but it's actually not true. The injectable testosterone that's used in TRT are actually testosterone esters. They're modified versions of testosterone, so you may have heard the terms testosterone cypionate, propionate, or enanthanate that are essentially Franken molecules. There's an ester that's added to the testosterone to increase the half-life of testosterone, because it's annoying to inject testosterone. It's a lot more convenient to inject it perhaps once a week, and these esters allow it to last a lot longer in your body. The downside of that convenience is that because they stick around so long, the body actually becomes suppressed and your testicular function, size, and fertility become suppressed. On the other hand, with native testosterone, because we've specially formulated it in a tablet that gets absorbed by the lymphatic system, meaning it bypasses first-pass liver metabolism, so it's safe on your liver and your kidneys, it can be taken once or even twice a day very conveniently, which mimics the natural biorhythm of your own testosterone, which increases in a pulsatile fashion every day. The second ingredient is enclomiphene. Enclomiphene is a SERM, or selective estrogen receptor modulator, which is distinct from clomid or clomiphene. It's actually the purified isomer of it, which basically is the part that blocks the estrogen receptor and is responsible for increasing testosterone. Head-to-head studies have shown that enclomiphene is superior to clomiphene in that it increases testosterone significantly without the side effects of clomiphene, including no reports of ocular or vision side effects with enclomiphene. Now, when you take the two of them together, native testosterone with enclomiphene, there's a special synergy that happens. Now, if you take oral testosterone replacement therapy on its own, it can suppress LH and FSH production by about 50+%. Now, with injectable testosterone, that's 90–95%. But LH is the marker that stimulates your own natural testosterone production, and FSH is the marker that stimulates your own natural sperm production. So they're useful proxies to know, am I still producing my own testosterone and sperm? Now, TRT on its own causes suppression of LH and FSH levels. And even though oral testosterone is not as suppressive as injectable testosterone, it can still have a negative impact on your fertility. However, what we've discovered, and you can read in our published white paper on our website, is that when you combine native testosterone with enclomiphene, it mitigates the suppression of testosterone altogether, meaning you can have your cake and eat it too. You can increase your testosterone levels with native testosterone while maintaining LH and FSH levels with the correct dosage of enclomiphene. Now, that dosage may vary a little bit for every individual, but our doctors monitor your blood work to prove that it works and titrate the just right amount of medication to get you the increases in testosterone and energy that you're seeking and maintaining your testicular function and fertility with the enclomiphene. In the clinical trial we ran with the Maximus Oral TRT Protocol, we found that this combination can increase testosterone multiple fold. So 2, 3, up to 5x free testosterone levels. So people can start to approach a total testosterone over 1,000 nanograms per deciliter and a free testosterone level of over 200 picograms per milliliter. Now, individual results, as always, may vary, but this combination is very effective for the majority of people. Even if you have primary hypogonadism, meaning your testicles don't function, the oral testosterone replacement therapy can increase your levels quite dramatically. And even if you don't have low testosterone, the enclomiphene can help stimulate your own natural production to maximize your levels so that you're feeling and functioning your best. So what are some of the benefits of the protocol? When we talked to participants in our clinical trial, the major benefit that they noticed was increased energy level. And this is not a caffeinated or stimulated energy. This is a calm energy that they're able to have all throughout the day, which also increases work and athletic performance. People reported being able to work at a higher level and have better performance in the gym. In addition, there's a clear psychological benefit. Our participants reported improvements in their confidence and assertiveness. Testosterone is typically associated with dominance, and so the feeling that you can do whatever your heart desires is increased with testosterone, and it makes hard work feel effortless. In addition, participants noted improvements in their mood. In fact, we saw clinically significant reductions in depression and anxiety levels. And while we don't market it as a mental health treatment, people did report dramatically improved mood. Participants also typically noted improvements in their sexual functioning, improvements in erection strength, and sexual drive. And while libido is a biopsychosocial phenomenon, meaning it's influenced by other factors, including stress levels and intimacy, it can help you improve your sexual drive and function. Finally, participants noted improvements in body composition. Testosterone classically increases lean muscle mass, and actually so does enclomiphene, showing up to 5 pounds of lean mass gains in 12 weeks on higher dosages. Thus, the combination of both testosterone and enclomiphene have a synergistic effect on body composition, increasing lean mass, and in conjunction with a proper diet and exercise regimen can help you lose excess body fat around the waist as well. Finally, participants reported improvements in their recovery as well. They're able to bounce back from workouts faster, and even if they were slightly sleep deprived, they're able to get through that next day at work without any problems. What was particularly noteworthy is that side effects were rare and mild. Anytime you increase testosterone, you also increase DHT. One of the advantages of oral testosterone is that it preferentially converts the testosterone into DHT instead of estrogen or estradiol. And thus you typically do not need an aromatase inhibitor like Arimidex or anastrozole in order to control estradiol levels, because the natural increase in your DHT levels essentially functions as a natural aromatase inhibitor and keeps estrogen levels at or even slightly below baseline levels. Now, in some participants, if you're already prone to hair loss or acne, increasing your testosterone levels can exacerbate that. But that's easily controlled with the addition of another medication called dutasteride. Dutasteride is like the bigger, stronger cousin to finasteride or Rogaine in that it's a 5-alpha reductase inhibitor, which blocks the conversion of testosterone to DHT. And thus, if you're prone to DHT exacerbations in your hair loss or acne, you can basically take a DHT blocker in the form of oral dutasteride, which blocks that effect and makes sure that increasing your testosterone is not going to come at the sacrifice of your hair or your skin. And at Maximus, we also offer oral dutasteride as an adjunct or an add-on to the oral TRT Plus protocol. So what's the process for getting started and trying it? When you go to our website, MaximusTribe.com, you fill out an online assessment, which includes your medical history to make sure that there's no exclusion criteria that would make it unsafe for you to be on our protocol. A doctor will review that and make sure that you are a good fit. And we determine eligibility not just based on testosterone levels, but on your symptoms as well, because we treat patients and not just numbers. And so there's no strict cutoff quantitatively for who is eligible and who's not. The doctor will take all of the information into account, but I can say that most people who are healthy can potentially qualify. After that, you'll be mailed an at-home blood test that you can take in the comfort and convenience of your own home. It's actually a device that sits on your shoulder. You just press a button, and it uses microneedle technology to collect a little bit of blood virtually painlessly, which is then shipped off to a lab via priority mail FedEx, and the lab can analyze that within 2 business days. The doctor will get those results and go over them with you and use that to make a prescribing decision about the right dosage of medication to take for you. Once you're on the protocol, you'll take it for at least 30 days and then redo the blood test to prove that it's increasing your testosterone and making sure that all your other markers are normal. In addition, we'll do another blood test at 3 months and then annually thereafter once your dose is stable and you're continuing to do well. At any time during the process, you have access to your doctor and clinical care team. So if there's any adjustments that need to be made to your dosages, any side effects or symptoms that are arising that you have questions about, Any side effects that are arising or any questions that you have, you can simply ask your doctor online. How do we know this is safe on my liver and my kidneys? Unfortunately, there's a myth out there that oral testosterone is toxic to the liver or the kidneys. This is based on a very old form called methyl testosterone and, of course, oral steroids, which can have a negative impact on the liver. Our form of oral testosterone, however, is actually specially formulated to bypass first-pass liver metabolism and get absorbed by the lymphatic system. And so we know from research studies that it doesn't have a negative impact on the kidney or the liver. And in fact, we'll prove this to you as part of the blood test. We measured two biomarkers, AST and GGT, to ensure that your liver and your kidney function are intact. How do you know this maintains your testicular function and fertility? So in injectable testosterone replacement therapy, or TRT, your LH and FSH levels, which are usually around 4 to 6, will go to near 0 to 1, showing a suppression in your testicular function. Because your pituitary is no longer releasing LH or FSH in any significant amount, the testicles aren't being stimulated. Thus, as a result, they shrink, shut down, and it creates infertility, which are the classic adverse effects of TRT. With our protocol, because oral TRT is short-acting and the addition of enclomiphene that stimulates the hypothalamus and pituitary to continue producing LH and FSH, we've shown in our clinical trial that LH and FSH levels remain high, which is a proxy for normal testicular production of testosterone and fertility. And in the blood work that you do, we measure your LH and FSH levels at baseline and again after treatment to ensure that it's staying within normal levels. How is this better than regular TRT? So first of all, this form factor is way more convenient. The enclomiphene can be absorbed sublingually under the tongue, and then the oral tablet can be swallowed and consumed with food to enhance lymphatic absorption. This is obviously way more convenient than doing an intramuscular or even subcutaneous injection. Even if you don't consider it painful, it's obviously inconvenient to inject yourself all the time, especially if you need to travel or you're around other people. And while the testosterone gels and creams are less invasive, they still have a risk of contamination if you are with a partner, and they can often be irritating to the skin as well. So these tablets are really a game changer in how easy and convenient they are to take. And we know that the best predictor of any treatment outcome is compliance, meaning that you're gonna stick with this and be able to do this as long as you'd like to. Second, the Maximus Oral TRT Protocol does a superior job at maintaining testosterone to estradiol ratio, meaning the balance between testosterone and estrogen is optimal in this protocol because this protocol preferentially converts testosterone to DHT instead of estrogen, meaning testosterone goes up while testosterone pretty much stays around the same. While with injectable testosterone or even HCG, testosterone can increase quite a bit, but so does estrogen, and that can often make men moody, throw off their libido, and is not optimal because you often have to take another medication, a prescription estrogen blocker such as an aromatase inhibitor, in order to control it. So TRT is a lot harder to dial in, while this, once you get the dosages right, is a lot easier to just set and forget. Finally, this is a huge advantage of maintaining your testicular function and fertility. Even if you don't particularly care about having kids at this moment, if you're a younger guy and you want to potentially maintain that option in the future, you should definitely not go on TRT. Our medical school advisors basically encourage anyone who's ever interested in having kids in the future or is under the age of 50 to not do testosterone replacement therapy. However, this is a game changer because you're maintaining your natural testosterone function with enclomiphene and your fertility with it as well. This can be taken safely by young men as young as 18 as long as they medically qualify because it doesn't put their fertility at risk, and we're obviously monitoring that with the blood work over time. In addition, if you're an older guy and you don't particularly care about your fertility, there are two other things that you should care about. One is your neurosteroid production, which are basically the hormones that are responsible for your cognitive function because you want to stay sharp for the rest of your life. One of the key neurosteroids is something called pregnenolone. We actually combine enclomiphene with pregnenolone to make sure that you're getting enough pregnenolone that converts to allopregnanolone and is responsible for the soothing, calming effect that makes you feel calm and confident as a man. In addition, because enclomiphene maintains your LH and FSH production, it's not going to impair or shut down your neurosteroid production like injectable TRT does. Most people don't really realize that when they inject TRT, not only are they shutting down their testicular function, they're shutting down their production of these really important brain chemicals in the form of neurosteroids that are really critical to your cognitive functioning and your mood. And when you maintain your LH and FSH production on this protocol, you never have to worry about any sort of cognitive impairments that you typically see with TRT. Furthermore, because we're maintaining your LH and FSH levels, you're maintaining your testicular size. So even if you don't care about fertility, I don't think most guys want their testicles shrinking or atrophying to the size of raisins, which is a common side effect with injectable TRT. With this protocol, it maintains your testicular size. In fact, studies that show that higher doses of enclomiphene actually increase testicular volume, meaning it makes your balls bigger if you care about that. So you can at least feel confident that you'll keep your testicles functioning and maintaining their size. How long does it take to start working? Studies show that the pharmacokinetics of oral testosterone typically peak within 3 to 5 hours and then get out of your system by about 8 hours. So you can take a larger dose once a day in the morning with fatty food, so you can get a nice spike in your testosterone levels, and if you so desire, you can take a second dose later on in the day. But for most people, the convenience of taking it once a day with a fatty meal gets a nice boost throughout the workday, and the binding to the androgen receptors will continue to have benefits all throughout the day in terms of the benefits in terms of body composition, mood, energy, etc. Enclomiphene has a half-life of about 10.5 hours, and the stimulation effect it has on the LH and FSH actually continues to persist for about a week. All in all, if you take the combination of these medications daily, you can ensure that you'll have optimal testosterone levels, in that your baseline levels will always remain elevated with enclomiphene, and that you'll get a nice natural rise and fall just as your body does throughout the day with the oral testosterone. Do I need to donate blood on this protocol? Almost never. One of the key advantages of oral testosterone is that it doesn't typically thicken the blood like injectable testosterone does. As I mentioned, because injectable testosterone lasts a week, it tends to increase hemoglobin or hematocrit, which can thicken the blood and lead to a condition called polycythemia. As a result, some folks on injectable testosterone have to do what's called therapeutic phlebotomy in terms of giving blood in order to reduce blood volume and thus de-thicken the blood. Because oral testosterone is a shorter acting form, it doesn't seem to increase hemoglobin or hematocrit as much as injectable testosterone does. Now, this is a marker that we do measure as part of the blood test, but it's incredibly rare to see a clinically significant or meaningful elevation in hematocrit that would necessitate giving blood. In fact, in studies with oral testosterone, the rate of polycythemia is incredibly low, somewhere on the order of 0.003%. So it is something that we monitor, but it is an incredibly low likelihood for it to occur unless you're elevated in hematocrit to begin with. Will this give me gynecomastia or man boobs? So one of the negative side effects of injectable testosterone is that it preferentially aromatizes into estradiol or estrogen. If that's not kept in control by lowering the testosterone dose or adding an aromatase inhibitor to block the conversion to estradiol, that excess estrogen that's floating around your bloodstream can bind to the receptors in your breast tissue and actually cause gynecomastia, or the development of male breast tissue. This is obviously a side effect that most men want to avoid, and so you have to very carefully monitor your estrogen levels on injectable testosterone replacement therapy. However, the brilliance of this protocol is that enclomiphene is a selective estrogen receptor blocker. In fact, this class of medications, called SERMs, is used as a treatment for gynecomastia. And so while we don't prescribe it for that reason, when you're concurrently taking testosterone with enclomiphene, it's blocking any excess estrogen from binding to the breast tissue. And so gynecomastia is incredibly unlikely on this protocol. And so you can have peace of mind with this protocol that you're not going to get gynecomastia. All in all, the Maximus Oral TRT Plus protocol is a game changer in that it provides the efficacy of traditional TRT while having a significantly improved safety profile that minimizes most of the side effects associated with traditional TRT. It is my firm belief that this will become the gold standard in testosterone optimization within the next 10 years because of the obvious convenience of oral tablets is superior to injections, and reducing the adverse effects of testicular shutdown, shrinkage, and infertility is a game changer that will make a lot of men much more open to optimizing their testosterone. Let me know if you have any questions in the comments below, and be sure to like, subscribe, and share.